Digestive disorders are becoming more and more common. IBS, inflammatory bowel disease, is an umbrella term used by gastroenterologists when they don't find a certain pathology in the intestines. If they do find certain pathologies within the intestines, whether it be the lower bowel or upper bowel, the patient may be diagnosed with an advanced form of inflammation of the intestines, such as Crohn's disease or ulcerative colitis. Again, if they don't find any specific tissue pathology, the umbrella term is IBS. This can be very frustrating for the patient because there's no specific treatment for IBS, whereas there are for Crohn's disease and ulcerative colitis. However, even without the specific treatment, the method of treatment or the intention of the treatment is very similar from one digestive disorder to another. And what's similar is that they're treating the inflammation. So IBS is inflammation of the bowel, and Crohn's disease and ulcerative colitis, they are also treating inflammation of the bowel, mainly with corticosteroids or immunomodulators. They will also treat the symptoms, whether it be IBS or ulcerative colitis or Crohn's, such as distension, abdominal bloating, alternating constipation and diarrhea. They'll treat those symptoms with certain medications that just target those symptoms themselves. And with IBS, again, that's anti-inflammatories and then medications to treat the nausea, to either stimulate peristalsis if the patient's constipated or to slow it down. These particular medications come with a long list of side effects which are unfavorable for the patient. So there's a lot of patients out there looking for supplements, trying to figure out their diet and treating themselves. And the internet, as we all know, is a very big place. So I, as a naturopathic physician, want to provide some guidance for IBS, and we can include ulcerative colitis and Crohn's disease. I specialize in digestive disorders because I myself used to suffer from that in the past and have controlled the symptoms successfully and have treated the cause. The cause of inflammation is an overactive immune system, and we have to ask why the immune system is so active against the tissue of the intestines. What is it trying to attack? One of the main issues that need to be addressed in IBS or any of these digestive disorders is dysbiosis. This means that you most likely have more bad guys than good guys. And this is caused by overuse of antibiotics, and this actually happens in the beginning stages when a patient has digestive system symptoms. The doctor, a lot of times the primary care, will assume it's H. pylori and start prescribing antibiotics. Unfortunately, this further progresses the inflammation because the antibiotics also kill the good guys and outgrows bad bacteria and yeast. Yeast is a big part of the problem, the pathology of inflammation of the colon. If we can get that yeast down and get the good guys back up, a lot of these symptoms can be resolved and possibly the cause can be treated. And a patient with Crohn's disease can live a very long and normal life. A lot of patients with Crohn's disease or ulcerative colitis, they can't travel. Their diet is very strict. They're taking the medications. A lot of times it ends up in surgery where they're having a large part of their intestines removed. I don't want that for my patients. I want them to go see a naturopath sooner rather than later at the beginning stages of these diseases before any of the intestines are removed so that we have more to work with. Although I have treated a patient where most of his intestines had been removed and he was on a bunch of medications, and he still is very alive and well and living a normal lifestyle and eating raw fruits and vegetables, which if you have Crohn's or ulcerative colitis or even advanced IBS, you'll know that that's a big deal because a lot of times roughage can aggravate the symptoms of inflammatory bowel disease. I choose powdered foods and herbal teas to treat digestive disorders. Many alternative medicine practitioners, we're big into supplements, just like conventional doctors are big into medications, we are big into supplements. When it comes to digestive disorders, my line of thinking is that you're having trouble digesting food, so why am I going to throw a bunch of pills at you? Supplements are even more difficult to digest than just regular table food. They are less bioavailable than your regular food. Our bodies are made to understand food, not so much isolate chemicals, whether it be in the form of supplements or medication. I'm not saying that there aren't supplements out there that can benefit greatly and help with these symptoms. As far as treating the cause, I do it with powdered herbal foods and herbal teas. The idea is to nourish, balance, and cleanse the body. We want to nourish it to give it the strength to balance itself out, give the immune system the strength to combat whatever it is that it's trying to fight. We want to balance out the friendly guys, get rid of the bad guys, grow good guys. This can be done with fermented vegetables. A lot of patients with advanced inflammation of the intestines can't even take a probiotic. They get sick from it. Fermented vegetables may be a better option for all of us, because instead of deciding and trying to figure out what species you need in your intestines, you can eat these fermented vegetables, such as sauerkraut, and let the intestines establish its own bacterial growth, its own friendly bacterial growth. And most patients can tolerate this. Bone broth is another useful tool that can be used to calm the inflammation down and get some high level of nourishment into the patient. Again, I choose herbal foods, which are powdered plant foods, so that the patient can get up the nourishment. A lot of these patients haven't eaten a raw vegetable in years, or raw fruit. And as we know, raw fruits and vegetables are the premier source of vitamins and minerals. How can one balance and help the immune system out and heal the pathology that's in the intestines when there's no nutrients to do it with? It's just like a car running on empty. The body must have living enzymes, vitamins, and minerals to function normally, let alone try to reverse a degenerative process that's going on. And I find that herbs are more powerful than even just your basic grocery store vegetable, and when juiced and powdered are easy to digest. It's like baby food for that patient. Stepwise process, we start building up the intestines again, get more good guys in there, and sooner or later the patient will now be able to add more healthy items to their menu and get their energy up and start expanding their diet to where it's full of just very healthy foods. And it's just a positive feedback system from there. But I do like to start with powdered foods, herbal teas, the nourish, balance, and cleanse system to begin with. I believe that naturopathic medicine is at the forefront of treating the ever-growing irritable bowel disease that's happening to more and more patients who are unsuccessfully being treated by the specialty of gastroenterologists. So I urge you, if you know of a naturopath, to go seek help with them and start that self-healing path.